not notice objects or people on the neglected side. The neglect type typically affect the left side of the space when the right hemisphere is damaged, which is more common scenario due to the role of right hemisphere in spatial awareness. Second one is the types of neglects. So first type is spatial neglect. The person may not respond to stimuli on the neglected side of the space. This can affect both personal space, example, not recognizing one side of their own body, and extra personal space, example, not noticing the objects in one half of the room. The second type is the perceptual neglect. The person may be able to see or perceive stimuli on the neglected side but fails to process or recognize them. For instance, they might not realize that an object is there even though it is within their visual field. Third type is the motor neglect. The individual might fail to see a limb on on the neglected side, not because of paralysis, but because of lack of awareness of or the intention. Third one is assessment and diagnosis. So clinical tests for unilateral neglect can be assessed using the one common test, that is line bisection test, where patient is asked to mark the midpoint of a horizontal line. The patients with neglect will typically mark the midpoint closer to the not neglected side. The another is the cancellation task, where patients are asked to cross out all the lines on the page. They often miss the lines on the neglected side. Second one is the observational diagnosis. Clinicians also observe patients' behavior in daily tasks, noting if they ignore one side of their body or environment. So brain areas involved in spatial neglect are right parietal lobe. The most common cause of the unilateral neglect is damage to right parietal lobe, especially the right inferior parietal lobule and the right temporoparietal junction. These areas are crucial for integrating sensory information and redirecting attention across the space. The right hemisphere dominance. The right hemisphere is particularly important for spatial attention and the awareness of both the sides of the space. When it is damaged, the left hemisphere may not compensate adequately, leading to the neglect of the contralateral side or the left side. Implications and the impact. Daily life. Unilateral neglect can severely impact daily functioning. Affected individuals may have difficulty with activities of daily living such as eating, grooming, navigating their environment. They may be at risk of accidents such as bumping into objects or failing to notice hazards on the neglected sites. Second one is the rehabilitation. So rehabilitation therapies, various rehabilitation strategies are used to help the patients recover from unilateral neglect. These might include visual scanning training, where patients are trained to consciously scan their neglected site, or prism adaptations, where prisms shift the visual field to encourage attention to the neglected site. Second one is the compensation techniques. Patients may also be taught strategies to compensate for their neglect, such as turning their body to the neglected side or using the tactile cues to bring attention to that side. Third is the theoretical and clinical insights. Unilateral Unilateral neglect has provided valuable insights into how brain processes special information